Hello and welcome. Today we're diving into a rare but serious condition affecting the liver, Budd-Chiari syndrome. This video will cover everything from its causes and symptoms to diagnosis and treatment, helping you understand this complex disorder. So, what exactly causes Budd-Chiari syndrome? In essence, it arises when the hepatic veins, which drain blood from the liver, become blocked or narrowed. These blockages prevent blood from properly flowing out of the liver. While the exact cause can be unclear in some cases, several factors are known to contribute. These include blood clotting disorders like polycythemia vera and thrombophilia, where the blood has an increased tendency to clot. Certain inherited genetic conditions can also play a role. Other less common causes include tumors pressing on the hepatic veins, infections, inflammatory conditions like Behçet's disease, and even the use of certain medications like oral contraceptives. In some instances, a web-like membrane may form within the hepatic veins, obstructing blood flow. It's also important to remember that in a significant number of cases, the underlying cause remains unidentified, which we refer to as idiopathic Budd-Chiari syndrome. Now let's discuss the pathophysiology, or how the disease develops. When the hepatic veins are obstructed, blood backs up into the liver. This congestion causes increased pressure within the liver's blood vessels, a condition known as portal hypertension. The liver cells, deprived of proper blood flow, begin to suffer damage and may even die, leading to liver inflammation and scarring, also known as fibrosis. Over time, this fibrosis can progress to cirrhosis, a severe and irreversible form of liver damage. The increased pressure in the portal system also forces blood to find alternative routes to return to the heart, leading to the development of varices, which are enlarged veins, particularly in the esophagus and stomach. These varices are prone to rupture and bleeding, a serious complication of Budd-Chiari syndrome. Ascites, the accumulation of fluid in the abdominal cavity, is another consequence of portal hypertension and impaired liver function. Budd-Chiari syndrome is considered a rare disease. Its exact incidence is difficult to determine because it is often underdiagnosed. Estimates vary, but it's thought to affect approximately 1 in 1 million people. It can occur at any age, but it is more frequently diagnosed in adults between the ages of 20 and 50. There appears to be a slight predilection for females, but the data on gender distribution can vary depending on the geographic region and the underlying causes of the syndrome. The signs and symptoms of Budd-Chiari syndrome can vary depending on the severity and speed of onset. Some individuals may experience a sudden, acute presentation, while others may develop symptoms gradually over time. Common symptoms include abdominal pain, often in the upper right quadrant where the liver is located. The abdomen may also become distended due to ascites, the accumulation of fluid. Patients may experience jaundice, a yellowing of the skin and eyes, due to the liver's inability to process bilirubin properly. Other symptoms include hepatomegaly, an enlarged liver, and splenomegaly, an enlarged spleen. Fatigue, nausea, vomiting, and lower extremity edema, swelling are also common complaints. In severe cases, patients may develop variceal bleeding, which can manifest as vomiting blood or having black, tarry stools. Encephalopathy, a state of confusion or altered mental status, can occur due to the liver's inability to remove toxins from the bloodstream. Diagnosing Budd-Chiari syndrome requires a combination of clinical evaluation, imaging studies, and sometimes liver biopsy. The diagnostic process typically begins with a thorough medical history and physical examination to assess the patient's symptoms and risk factors. Liver function tests. A series of blood tests are crucial in evaluating the liver's health. Elevated liver enzymes can indicate liver damage. Imaging studies play a vital role in confirming the diagnosis. Ultrasound is often the first-line imaging test, allowing visualization of the liver and hepatic veins. Doppler ultrasound can assess blood flow through the veins. Computed tomography as CT scans and magnetic resonance imaging (MRI) provide more detailed images of the liver, hepatic veins, and surrounding structures, helping to identify blockages and assess the extent of liver damage. In some cases, a venogram, an X-ray of the veins taken after injecting contrast dye, may be performed to directly visualize the hepatic veins. A liver biopsy, where a small sample of liver tissue is taken for examination under a microscope, may be necessary to confirm the diagnosis and assess the degree of liver damage. It can also help rule out other liver diseases. While there aren't strictly defined types of Budd-Chiari, it's helpful to categorize it based on the speed of onset and the location of the obstruction. We often talk about acute, subacute, and chronic forms. Acute Budd-Chiari presents suddenly and severely, with rapid liver damage. Subacute develops more gradually over weeks or months. Chronic Budd-Chiari progresses slowly over months or years, often with less dramatic initial symptoms. Additionally, the location of the obstruction can vary. Some individuals have blockages in the large hepatic veins close to where they enter the inferior vena cava, while others have blockages in smaller veins within the liver itself. The primary goals of treatment for Budd-Chiari syndrome are to relieve symptoms, improve blood flow, and prevent further liver damage. Treatment strategies vary depending on the severity and location of the obstruction, as well as the patient's overall health. Anticoagulation, or blood-thinning medications, are often the first line of treatment to prevent further blood clots from forming. Diuretics may be used to manage ascites, the fluid accumulation in the abdomen. Procedures to improve blood flow include angioplasty, where a balloon is used to widen narrowed veins, and stenting, where a small mesh tube is placed in the vein to keep it open. A transjugular intrahepatic portosystemic shunt (TIPS) is a more invasive procedure that creates a connection between the portal vein and the hepatic vein, bypassing the blocked hepatic veins. In severe cases, a liver transplant may be necessary to replace the damaged liver with a healthy one. Management also involves treating any underlying conditions that may be contributing to the syndrome, such as blood clotting disorders or inflammatory conditions. For patients with varices, endoscopic procedures may be performed to prevent or treat bleeding. Unfortunately, there's no single, guaranteed way to prevent Budd-Chiari syndrome, primarily because the underlying causes are often complex and sometimes unknown. However, managing known risk factors can help. This includes treating blood clotting disorders effectively, as well as addressing other conditions associated with the syndrome. Maintaining a healthy lifestyle, avoiding excessive alcohol consumption, and undergoing regular medical checkups can also contribute to overall liver health. If you have a family history of blood clotting disorders or liver diseases, discussing this with your doctor is crucial. The prognosis for Budd-Chiari syndrome varies depending on the severity of the condition, the speed of diagnosis, and the effectiveness of treatment. Without treatment, the condition can rapidly progress to liver failure. However, with timely and appropriate treatment, many individuals can achieve significant improvement and maintain a good quality of life. Liver transplantation offers the best chance of long-term survival for patients with severe liver damage. Recent research has focused on developing new and improved treatments, including more effective anticoagulation strategies and less invasive procedures to improve blood flow. Studies are also underway to better understand the genetic and molecular mechanisms underlying the syndrome, which could lead to the development of targeted therapies. Continued research is crucial to improving outcomes for individuals with Budd-Chiari syndrome.